IBS, or Irritable Bowel Syndrome, affects 45 million Americans. It dictates what you can eat, how you should eat, and general lifestyle changes you need to make to accommodate it. Well, joining us is Dr. Rajiv Sharma, integrative gastroenterologist and founder of Pursuit of Gut Happiness. It's great to have you.
Thank you.
I like that, the pursuit of gut happiness. An unhappy gut is an unhappy person.
No, that is correct. You need a happy gut to be a happy person.
And it dictates so much of your general overall health. And I want to get into that in a little bit. But first, define for us what IBS is and what are some of the typical symptoms?
Sure. You know, I'm a practicing gastroenterologist, and every time I see an IBS patient, the one common symptom is, doctor, I feel I'm 9 months pregnant.
Oh.
And mostly females, they suffer from IBS because of hormones and increased excitability of the nerve cells of the gut. The typical symptoms of IBS include bloating, gas, belly pain, diarrhea, and constipation. And a lot of times diarrhea and constipation will fluctuate.
Well, and one other thing I wanted to also understand is the difference between IBS, is it SIBO, S-I-B-O, and then celiac disease. So we tend to hear these things kind of all affecting your intestines and your gut. So what is the difference between those three?
Great. That's a great question. And all day, that's what I'm answering for my patients. So there's a new school of thought which is telling us that IBS is overdiagnosed. It's a label sometimes for complex GI issues or gastro issues which are unresolved. And SIBO is one of those issues. SIBO, or small intestinal bacterial overgrowth syndrome, is a condition where the lining of the gut is inflamed by increase in the number of bacteria, which will cause irritation in the gut and will eat away the nutrients which are meant for the body. And that leads to gas, bloating, nutrition deficiencies, diarrhea, and just a miserable feeling. And then celiac disease is a condition where gluten, as you know, we all know what gluten is. It's found in wheat, rye, and barley. So gluten is a peptide. It's a molecule that triggers the immune system of the GI system, and the cells, the lymphocytes, they attack the lining of the small bowel, and they cause ulcers and pain and discomfort. And it can eventually cause malabsorption, malnutrition, vitamin deficiencies, skin rashes, memory issues, joint pains, and bone fractures. So celiac disease and SIBO, a lot of times, are misdiagnosed as IBS.
Oh, interesting.
So anytime somebody says they have IBS, we have to make sure there's nothing organic going on, such as SIBO, celiac disease, Crohn's disease, food allergies, food sensitivities, and the list goes on and on and on.
Right, yeah, Crohn's disease is another one. Now, you mentioned some foods that you should avoid if you have celiac disease. Are there foods that are particularly triggers of IBS?
Yes, there's a class of foods known as FODMAPs, F-O-D-M-A-P, FODMAPs. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Polyols are sugar alcohols. You know, these are found in artificial sweeteners. When we drink a Starbucks and a coffee, we add those extra pumps of sweeteners and creamers and flavoring agents. These are found in those kind of additives. And they can trigger IBS symptoms by sucking in water from the gut, which can create an osmotic effect, and that can cause discomfort, gas, bloating, diarrhea, and just miserable pain.
Wow. So you really need to change your lifestyle. You need to be aware of the things that you should and should not put in your body, probiotics being something that's healthy for you?
Yes, absolutely. There's many schools of thought. but my practice and my experience, both personal, my family's, and my patient, has been probiotics work. You just have to make sure you have the right type, the right kind, and you have to make sure that probiotic itself does not have extra sweeteners or flavoring agents, gluten in case you have any sensitivities, and allergens. Because supplements could also carry toxins which could kind of undermine the benefit of the probiotics.
And it sounds like you do something a little bit different, maybe less traditional, but you also incorporate meditation as a part of treatment, which I think is so fascinating. I also want to mention that you do have a book, Pursuit of Gut Happiness, that people should check out. And you're also going to be coming out with a line of vitamin supplements as well. So we're going to direct our viewers to your website. I want to thank you so much, Dr. Raj, for joining us.
Thank you so much. It's been a pleasure.
Thank you. We're back after this.